Hi, my name's Andrew Scheim. I'm an advanced body worker, and I'm here with Kathy Claus today to discuss one of the newest additions to my practice, the rapid release machine. I use a wide range of modalities, including electroacupuncture, cranial psychotherapy, neuromuscular, various forms of connective tissue work, and recently we've added the rapid release machine. So Kathy, how are you doing today?
Doing good. That's pretty amazing because in 9 days we drove over 3,000 miles, and so this has really helped.
Thank you. Just can you briefly describe, with all the modalities and work we've done over the past couple of years, when I started using the rapid release, what was your experience?
Things were working, but it was injuries were slower to heal, and the rapid release really made a difference. It sort of cuts through a lot of the like the scar tissue or whatever. Uh, Kind of gets right to the meat of the problem, I guess you could say.
By the way, literally, this device goes through connective tissue very deeply, and if there is scar tissue, it actually goes down, literally down to the bone. So if you have a joint injury, it'll actually uh, break down scar tissue and adhesions. But in addition, as Kathy's saying, it'll really move connective tissue in a very deep way. So, any other observations? Do you find this painful when we use the rapid release?
No, there are certain times when a towel or maybe even 2 layers of toweling, if you've got a really tender spot like my ankle, for example. But no, it's not painful at all. It actually, there's almost an aha that comes after using it, which I didn't expect, by the way.
Great, and that's always a plus. We're trying to get the deepest level of release with the least amount of pain. One of the biggest challenges in doing the work. I'm sure some of you have had some modalities such as Ralphing. It can be pretty intense at times. So this is real nice because it does a lot of work with minimal pain. And like Kathy said, it feels good when there's that release going on at a deep level. Okay, so Kathy, I'd like to discuss with you, in general, the results you've had coming to see me. We've talked about how the rapid release has made things work even quicker and better, but I just kind of wanted for you to convey a sense of my work and what you feel about the work and some of the injuries you were struggling with when you came to see me and the results you've gotten and what preceded before coming to see me.
I came in specifically with a sciatic injury, and it was extremely painful. And it flares, but it was chronic, and it's not chronic anymore. So that was the thing. And the second thing was an old neck injury from a long time ago. And when I came in, I had a bulging disc in my neck, and my husband, who is an incredible skeptic, noticed some months ago that the disc was not bulging anymore. So he's pretty impressed.
Could you just briefly describe what you had tried to do before in terms of getting treated? What was different in our treatments together?
I've seen chiropractors for years, and it helps. I'm not going to diss chiropractors, but I think I needed something that was more ongoing and that was going to work a little bit deeper. And so I found Andrew online, and it was a sciatic injury at the time that was really painful. So that's what brought me in, and we've worked on all kinds of things. So things are tremendously better than they were 2 years ago. And the rapid release has made them go faster. It was not that I wasn't getting any relief, because I was, but it's amazing how much more gets done in a treatment session because of it. So it's not just the rapid release that Andrew uses. It's all of the modalities, some electric acupuncture, but less than before, some cranial sacral, and boy, when that works, it's just awesome.
Right. Could you briefly describe what you, to, for a layperson who wants to know what cranial sacral is, what is cranial sacral?
Well, I know what it feels like to me. There's when things are working, it's like a wave. And Andrew's had me actually put my hand touching his while he's working on my neck, for example. And I can feel when it starts to wave, when things start opening up. And there's kind of this aha feeling. I don't know if everybody can feel it, but I can, and it's really a neat modality. I like that as well.
To just add on my own, in acupuncture, you're checking the movement of, think of it as streams and rivers of specific energy movement in the body. And the cranial sacral wave is like a deeper global wave that runs through the body. And when it flows in an organized and very healthy way, a person feels tremendous relaxation, as Kathy's saying. So really, although very subtle, is probably one of the most critical modalities to know in bodywork. Unfortunately, to get that wave to work functionally, you need to do a lot of other work, which is why rapid release, why electroacupuncture, there's a lot of levels that one has to work to achieve results, and I've studied these for many years. Let's see, any other observations?
I think one of the things that has amazed me is that Andrew has found injury sites and said, "What did you do here?" And it's something that's an old injury, and I just sort of live with it, and it's kind of the way life is. And I was like, "Oh well, yeah, that's where the dog ran into my knee and pushed it backwards and things like that." So that's been really almost freaky because he's good at ferreting out old injuries, and so truly, 2 years ago, I could not have driven in a car with my husband for 3,000 miles in just over a week, and come back feeling pretty darn good. So that to me is sort of the benchmark. And we did 1,100 of those miles in one day, and I never could have done that before.
So thank you. Let's see, any other comments in general?
I think that the techniques that you have developed using rapid release are part of what has made it work. The sort of flexing and resist, persist, release. That's, sorry.
I don't know. By the way, Kathy's referring to a neuromuscular technique that I've integrated with rapid release.
And it really has worked a lot. When you've got an injury that's been with you since you were a little kid, and you're talking about something that's 50 years old or 30 years old or whatever, it takes some time to heal it, because the body almost freezes in a way that it's sort of gotten comfortable, and so it's almost like a retraining it to go back to the way it should be instead of the way it is, and that's been really nice.
So it's been a blessing to work with you. Thank you for coming by for this interview.
You bet.